I'm Michele Vasquez, and I'm going to be giving my demonstrative speech, and I'll let my audience go ahead and introduce themselves.
I'm Kelly. I was here for Michelle's speech last week. I'm her friend from elementary school.
Hi, I'm also here from last. My name is Edgar. I'm 21, and I am her son-in-law.
I'm Mike. I was here last week. I'm her lover.
I'm Billy, 20, and I'm her son, and I was here last time.
And I'm Victoria Moore.
Okay, we'll go ahead and get started. I'm actually going to be giving a speech today over the, lost my train of thought, actually giving a speech over treating yourself for diabetes or checking for diabetes, the importance of that. We'll get started. I do have my presentational aids behind me. And again, going to diabetes. Diabetes actually is a problem with your body that causes your body to either produce too much insulin or not enough. And diabetes goes underlying many, many times because people don't realize the significance of it or the importance of being checked for it. The American population in 2012, the prevalence of diabetes was 29.1 million people were diagnosed with diabetes, or 9.3% of the population had diabetes. Approximately 1.25 million American children and adults have type 1 diabetes. With type 1 diabetes, it actually, your body doesn't produce or use actually the insulin enough, so then therefore your body has to make up for it. Out of the 29.1 million, 21 million were diagnosed, and 8.1 million were undiagnosed. They didn't even know that they had it. It affects seniors. Americans age 65 and older remain high at 25.9%. 11.8 million seniors diagnosed and undiagnosed with that. New cases are 1.4 million, and that goes every year. Prediabetes is before you actually develop diabetes. That's what we're trying to keep you from actually developing. 86 million Americans aged 20 or older had prediabetes. And 79 million, that's up from 2010. And those were the latest numbers, and that was based off of the statistics gotten from the American Diabetes Association. Death related to diabetes remains the 7th leading cause of death in the United States. In 2010, there was 69,071 deaths. And that was the death certificates actually listing it as an underlying cause of death. A total of 234,051 death certificates listed diabetes as an underlying contributing cause of death. So again, going back, we actually have to look at all the symptoms that are related to that. Again, people with diabetes have a higher % death rate than the person without diabetes. Diabetes costs approximately $245 million in medical costs and lost wages. In 2015, August of last year, I was diagnosed with type 2 diabetes. I originally went to the hospital with low oxygen saturation levels, which turned out to be a case of pneumonia. I had routine blood work drawn, and the day my test came back, they were elevated. Didn't really think too much of it. And they did an A1C, which is a test to check your sugars, and it was high. So once you actually are labeled as having an A1C, you will be labeled the rest of your life as having diabetes, whether it's treated or non-treated in the medical field. Again, you want to know how to identify the symptoms, and the symptoms can range from a variety of things. Usually with the symptoms, you experience weight loss, extreme tiredness, blurred vision, going to the bathroom, especially at night, more than normal, increased thirst. If you're drinking and you just can't quench that thirst, that's a major indication. And testing for type 1 diabetes it's fast, it's painless, and only takes a few seconds. You want to make sure you definitely have your doctor check for those. And again, some of the other symptoms that can actually go with that, again, if you notice any of those, make sure you get to your doctor right away. Some of the other ones that are involved, again, can be anywhere from numbness and tingling in your feet, and that's usually related to type 1, type 2 actually. Bruises or cuts that don't heal fast, and then again weight loss, and that's more with your type 1 diabetes. Again, there's the two types, is type 1 and type 2, and then there's gestational diabetes as well that develop when you're pregnant. Again, those were just a few of the symptoms, and if they're left untreated, you can develop hypertension, high blood pressure, increased risk of stroke, heart attack, eye problems, and gastroparesis. Gastroparesis is where when you eat, your food isn't digested, it just actually sits in your stomach and doesn't go anywhere. And my father actually developed that. He had pancreatic cancer and developed that as well. Many other complications can arise just from mention a few. That's why I can't say enough how important that it is to be checked on a routine basis. Again, there's simple tests that you can use, or they can use to check you. An A1C, again, is a sugar test. You've got your fasting plasma glucose, also known as the FPG. The OGTT was an oral glucose tolerance test, and that you actually drink a sugary substance and then wait a couple hours and then you're tested. Once you've been tested, hopefully your levels are normal. And again, according to the American Diabetes Association, normal levels for a normal person would be less than 140. Pre-diabetic is 140 to 199. And then you're considered diabetic, full-fledged diabetic, if it's 200 or over. If your blood work isn't normal, then your doctor's going to recommend treatments, which again can vary per person, just depending on your situation. That is why it's very important to go as early as possible to be checked, just to make sure you don't have it, because once the damage is done, it's hard to come back from it, if at all. Again, diabetes causes more deaths than breast cancer and AIDS combined. People should know the symptoms, complications, and how to treat, how to prevent, and keep themselves from falling prey to this deadly disease. I'm going to demonstrate now one of the tests that you may also be required to do, such as I did. I was pre-diabetic, so I was advised regularly to eat properly and to check my sugar levels. And again, at different times of the day, just to make sure that I didn't have anything arise or my sugar levels went up. Normally, you're given a glucose meter, such as this one here. They do come in different styles. Some you actually can check on your leg, your thigh, anything like that. So I'm doing the demonstration. And your test strips will come in here. They look like this. And then they will just slide actually into the end of your meter. This is your lancing device. This screws off. And then you have a lancet, which has a needle in it. You would, of course, before you did all this, would wash your hands. This just fits in, clicks. You turn this, and now the needle is showing. So be very careful not to poke yourself. And then this just clips on like this. You have a setting meter down here, depending on how you like, because it does hurt, I'm not going to lie. I just set mine on 3. Then you pull this back, and that sets it. So when you push your button, it then will poke your finger. I'm not actually going to poke my finger, because I'm just not going to do that. And you would take this, you want to put it on the side of your finger, not on the bed of your finger, because their fingers will get very sore if you use the same one over and over. You would take it there, push your finger, you're going to get a drop of blood. You would take your strip, stick it into the end of your meter. Again, you've got your blood there. You hold your strip next to the blood droplet, and it works like a little straw. It will suck it up into there. Once it sucks it up into there, it's going to give you a readout on your meter. And then that's what you're going to go by. Mine is preset from the diabetic counselor. So if ever it tells me if my normals are within normal range or if they're elevated. Thank goodness, since the last year, I have not had a high glucose level. So I only monitor it about once a week now until I'm further advised differently. So that, again, is just one of the tests. Very simple, very easy, but again, it assures you where you need to be. And again, with the types of diabetes, you want to make sure that you are checking that regularly if you are advised to. Don't take it for granted, because it's not anything to play with. Again, those of us that should be checked for sugars. Again, if you're already taking insulin, if you're pregnant, if you have a hard time controlling your glucose levels, and again, if you've already had like ketones in your urine, and that would have been determined by urinalysis when your doctor drew urine as well. And again, that explains how the tests are done. Again, you may be required to do other testing. Just make sure that you want to check those levels. The targets for most adults, again, before a meal would be 80 to 130. That's a normal level. And again, that's 1 to 2 hours after starting the meal. After that, it should actually be less than 80. If it's higher than that, that is to be concerned about, unless you ate an extremely sugary meal. And again, urine testing, it's not as accurate as the blood glucose, but they do draw, to do urinalysis just to check for the ketones in the urine. Again, you want to try to delay this disease from progressing. So again, don't permit this disease to consume you and allow yourself to become a statistic. That's the main purpose of my speech. Make sure, again, educate yourself, friends and family members on eating healthy, living an active lifestyle, making sure you get tested for the disease. Don't let things go untreated. And again, the levels, we want to keep them at a normal level, if at all possible. And how many of you now are going to be tested, or has this woken you up?
Tested for what?
For diabetes. For AIDS, no, for diabetes. Obviously, you weren't paying attention. Again, so please do monitor this routine on a regular basis. Be checked annually so you don't have to deal with any of these complications. I could have shown you more vivid photos, but it would have been way too much. So I do want to thank you. And that does conclude our speech. Make sure you do follow everything you're supposed to and be checked. Thank you.
Love you.